In this video, I answer a question from a massage therapist on why I think trigger point treatments aren't an effective treatment, but can also be dangerous for the client. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a non surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a significant increase in flexibility, function, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so a question came from a massage therapist named Ryan from Maryland, who's been in practice since 2016 and specializes in working with more active clients who want better recovery from their workouts and training. The question was, I do a ton of trigger point work on my clients and find that they continue to come back even when I treat them aggressively. I saw some of your comment where you talked about why you don't bother treating trigger points, but you also said they can be dangerous, which I've never heard anyone say. I know the work I'm doing is only a temporary fix, but how could it ever be dangerous for the client? Thanks for sending that question in, Ryan. Just a quick reminder, I do love doing these types of videos. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, I'll get a video out to you. The info to submit your question is in our profile or wherever you're consuming this video. Let's get into it. So I got I guess they call it the Bible of trigger points, Travell's book, Myofascial Pain and Dysfunction, the Trigger Point Manual. Some people look at this as holy doctrine in the musculoskeletal space. I think there's a lot of good stuff in there, but a lot of things miss the boat. So, what are trigger points? From my standpoint, trigger points is a chemical response in the muscle when things are getting overloaded and being just put into positions that it doesn't want to be. I a lot of times say the trigger point is a reaction to something else having an issue. And a lot of times what it is underlying problems, maybe with the bone, the cartilage, the disc, the ligament, nerve entrapments, or even like scar tissue buildup as well. The trigger point gets in there to basically offload the area and take the pressure off. It's like a protective type of mechanism. Why do they form? They just form in response to tissue getting overloaded. The body's number one thing is like it wants to protect damaged areas. So it has a trigger point form in the short term of trying to help ease the load on that area and kind of unload it a little bit so it doesn't continue to get damaged more. What I'm always looking at is it the cause or the effect? And for me, in my 15 years of practice and what I've seen in my clinical practice is I really believe the trigger point is more of the actual effect, not the true cause. So when you're just treating the effect, you're not getting the cause. This is why things continue to come back and you're not getting any long lasting relief from them, or the trigger points continue to lay down. There's this idea called protective tension, and the idea is the body wants to protect things that are damaged, and the most important things that it wants to protect is going to be the nervous system. So if there's like an underlying nerve entrapment where the nerves basically get stuck inside the muscle with adhesion and scar tissue around the muscle, might tighten up to protect that area. Or maybe there's like some underlying damage to the disc or the cartilage or the bone or possibly the tendon. So this protective tension kind of kicks in. I always say it's kind of similar to like when you sprain your ankle, your body knows the limp because it's unloading that area. And I think that's why trigger points are forming in the first place. Travell, very smart lady, lived a long time ago. I think she was born in like 1909. I've read her books. I've taken courses on that and everything like that. And she talks about it in the material where, especially in like low back spasm types of clients, where she's continuing to see like QL trigger points forming, she would like do the work on the trigger points, but then the problem would continue to come back because what was happening is she was addressing, like I said, more of the protective tension, more of the effect, not the true cause. In my research, I saw that she was actually JFK, the president of the country back in like the 60s. She was his personal physician and helped him a lot. And it's been historically known that he had a very debilitating back injury throughout his life, where he had so many problems in there where, he could barely function. And she was the one first and foremost treating him. So it kind of makes me question a little bit more about like was she actually doing effective. I'm not trying to like bash someone that's considered a pioneer by some people, but if that treatment was actually working, like why did his debilitating back pain never really get better? So when I look at treatment, I always kind of put it through a lens and try to figure out where it is and how it is so I can determine if it's going to be effective and if it's going to actually help. First, it's got to be safe. Is it safe? Is it going to cause harm to the area? Next, is it effective? Does it actually do what it's supposed to do? Lastly, is it durable? Is it long lasting? Is it not something where like they feel good for like a couple days, maybe a week or so, but then that problem comes right back? We also want to make sure that we do the correct dosage every single time. I always say treatment is like a medication. You can give enough to be effective, but you can overtreat it. Many manual therapists, including myself for years, we always thought treatment could only go one of two ways. You know, we could treat it and it would be better, or we treat it and nothing would change. We never really consider that we can overtreat that area and make that problem significantly worse. And then once again, getting to the cause of the effect. Are you treating the cause? Are you treating the effect? So these are like the criteria. This isn't like me, you know, yelling at you and telling you that your kid is ugly. It's just like factual. Like, is the treatment safe? Is it effective? Is it durable? Are you doing the correct dosage? Are you treating the effect? Are you treating the cause? If you're not doing that stuff, then it's not actually a treatment. You're maybe temporarily helping it feel better, but you didn't actually fix anything. And lastly, we always want to answer the question of why. Why is something tight? Why is something weak? Why is something inhibited? That's one of the favorites. You know, the glutes aren't firing because they have amnesia. You have gluteal amnesia. And so it's like, no, it's not firing for a reason. We have to answer all those questions, and just jumping right into a random treatment without answering the why would be like your check engine light came on in your car. You take it to the mechanic and they just start hammering away at it and don't run any diagnostics. But we do the same thing all the time with the human body, which is a million times more complicated than a car. So, why can trigger point treatments potentially be dangerous? First is they create these reflexive changes. So, when you treat the trigger point, essentially what you do is you stimulate some stuff. So, in your body on the pain pathway, there's this pathway called the lateral spinal thalamic tract. And two things run up that pathway. One is vibration and movement, and the other one is pain. And a lot of times when you're treating a trigger point, you're getting the mechanoreceptors to fire. It's blocking some pain where that trigger point temporarily lets go, but it didn't actually do anything to improve the tissue. So it improves the symptoms, but it doesn't improve the function. I say any treatment that only improves symptoms but not function is actually dangerous. It also gives the client a false sense that they're actually better, where they might like be like, hey, you know what? I feel so much better. Everything feels looser. Maybe they're having like low back spasms. You do some trigger point work in the QLs and they're like, man, I feel so much better. And then they decide, hey, I'm going to go to the gym. I'm going to deadlift a house and see how it goes. And now what they did was they really, those trigger points were hiding some of the dysfunction in there, you know, especially in like the discs and the nerve entrapments. Now they load that area and that problem becomes a hell of a lot worse. When it might be okay to do, maybe when they're in like severe pain and they can barely move and you just want it to kind of settle down. But that comes with having a conversation with the client and being like, hey, I'm going to get in here and do this. It's just going to help you just get out of pain for a little bit. But I want you to just to take it easy on this after. I don't want you to go to the gym. I don't want you to do a bunch of stuff. And a lot of times people get these treatments and they get this false window where they feel like they can do more, but that tissue gets exposed even more and it can cause bigger problems down the road. So what do I treat? What do I see? Most people, when they encounter trigger points, what they're actually encountering is either an adhesion buildup, a scar tissue buildup, and a nerve entrapment in the area. And then the treatment isn't correct as they do that, which is like what Ryan was saying in this issue. Like he's treating it, but it continues to come back. So what is adhesion? How does it form? Basically, over time with bad postures, injuries, all sorts of things, lack of oxygen. The muscles get constantly contracted. They don't get enough blood flow and oxygen. Body thinks there's an injury there, starts to lay down this stuff called scar tissue. It's immature collagen fibers that get inside the muscle. First, it makes the area less flexible, then it makes it weaker, and then eventually it gets stuck to the nerves. It creates a nerve entrapment. Now, nerves do not like to be stuck. They hate when they're entrapped. They get really angry, really pissed off. And when that happens, that's when you start to get more inflammation. Um, you might start to get some postural distortion, some biomechanical things, you know, like shoulder leaning forward, glutes not firing, everything like that. We have to get to the why of that as well. And my favorite people in the entire world, which they're not my favorite people, are usually physical therapists that bash manual therapy because they actually suck at it. Um, and what they do is they always use the same study. It's like where they like tried to treat like adhesion in the fascia in the foot, and they're like, well, basically you need like superhuman strength, like 10,000 pounds to actually break it down. And then they basically use that as their whole guide of why manual therapy doesn't work and why soft tissue based treatments don't work. It's just because they suck at it. They're not good at it. It takes skill, it takes repetition, it takes practice, it takes diligence, and they don't like to do that. And they usually say, where's your study? Where's your double blind placebo? Don't even argue with those people. They're just glorified personal trainers. So why is this type of treatment safe? Because we're not cutting them open. We're not damaging a lot of tissue. It's very non-invasive. It's the side effects are very minimal, maybe some soreness or a little bit of bruising, like nothing crazy. Why is it effective? Because when you actually go in and break down the adhesion and free up the nerve entrapment, you actually get a real mechanical change in the tissue in the muscle that's long lasting. And why is it durable? Because when you actually break the adhesion down, you start to get blood flow, oxygen back to the area, and it starts to heal up, and all the waste products and all the stuff that's gotten stuck in the muscle throughout the process and the nerve actually starts to go away. So it's safe, it's effective, and it's durable. Here's the thing: if we looked at a trigger point under a microscope, it would look exactly the same as a normal muscle. It's just having like a more enhanced response in the tissue. Whereas if we look at adhesion under a microscope, it looks like this photo in here. It's just a bunch of junk that's just accumulated in there and causes a lot of problems. So the proper treatment process, so with trigger points, it relies a lot on pressure and holding things down, which I said temporarily allows things to relax, but doesn't do anything. First is we have to start with functional tests and detailed palpation. We have to know exactly where the adhesion is based off range of motion, based off movements. Taking a thorough and in-depth history is going to allow us to see that. And then we're going to know where to go and find those nerve entrapments. Instead of checking the whole muscle, we're going to find the areas where the nerve entrapment most likely occurs. Then once we find it, we're going to shorten the tissue. That's going to allow it to relax. Then we need to get proper depth into the tissue, and then we need to come out a little bit. So a lot of times when providers are treating, they just go all the way in and they don't give a chance for the tissue to accommodate. And then that just basically traps the tissue in there. It hurts like hell. The client thinks you're doing something, but it's actually not making any changes. Once we get that depth, we back out about 10% and let the tissue kind of accommodate. It's like getting into the tissue nice and slow and allowing it to be receptive to getting treatment. Then once we do that, we set the tension into the adhesion. We pause for a little bit, let that load up. Then we have the client go through an active range of motion as they move it, whatever they're doing. And this allows the tissue to slide. As we do that, we're continuing to keep our depth. We're continuing to keep our tension, which in turn is actually breaking down the adhesion and allowing it to heal up, allowing that adhesion to break free. So that's all I got in the video. I appreciate you watching. Got any insights you might have, share them in the comment section below. I try my best to engage and talk with everyone and share information back and forth. And I'm more than happy to have my mind change on things. Like I said, these things are my opinion, what I've seen in my clinical practice. Next is you can share with other providers that might help. Do me a solid and share with other people that want to do good work, help people get out of pain. And lastly, if you like what I'm teaching, you like what I'm training, you like what I'm showing, you can go download our free training modules. We actually have a whole module in there about proper depth and tension and tissue slide and letting you understand the components and all the vectors in proper treatment so you can get long lasting relief. The links to download the training is wherever you're consuming this video. I appreciate you watching, and I'll catch you on the next one. Bye.